Hi, everyone. Welcome and thanks for coming. I think the plan is to be relatively informal with the questions, so feel free to type your questions into the chat box. Or I'm also fine if you would prefer to ask, live on camera. So absolutely up to you. And I'm going to pull up the chat and kind of monitor what I see. While I'm waiting for a few questions, hopefully you all had time to view the presentation that I submitted. But essentially, the lecture summarized some of the evidence that we have right now in the scientific literature for the benefits of physical activity for women with ovarian cancer, as well as the results from a new program that we run in my lab called Fit Cancer, that we recently transitioned to be completely virtual last year. The years are sort of blurred together at this point, but so relatively recently we took the program that used to be 100% face-to-face, sort of a typical group-based exercise program in the gym, and then transitioned that into a virtual setting, which was challenging and a lot of fun. And we were fortunate to have a lot of success with the program so far. So I'm happy to answer any questions sort of in general about physical activity and cancer survivorship or specific to our program. Okay, I have one question here. Yes, so related to fatigue, so this is a question we get very, very often related to how does exercise help fatigue, and is there an ideal level or amount of exercise for fatigue or to help reduce cancer-related fatigue? And of course, it's never a simple answer, but in general, what we tend to counsel our program participants on and our study participants is, by the end of your exercise session, you should feel better than when you started. So particularly when you are undergoing active treatment, so either radiation therapy, chemotherapy, I think it's really important to pay attention to how your body feels, right? Like, we can have these sort of set in stone exercise prescriptions, but given the nature of cancer treatments that are very cyclical, some days are up and some days are down, we often counsel our patients to really listen to their body, and some days, moderate intensity might be less than another day. So there's no, like I say, set in stone exercise prescription that we can provide sort of across the board. So a lot of it is individualized and has a lot of nuances. So I know that's not incredibly helpful, but I think, like I say, the best advice we often give is listen to your body, and you should feel better after the exercise session, and not just immediately after, but even the next day or later that day. And if you're not feeling better, you're feeling more fatigued or just totally wiped out, then it might be time to consider dialing back the intensity a little bit, or maybe the volume or the total amount. Dial it back a little bit, and you can always slowly progress to more. Does that answer your question, Joanna?
Yes, thank you. That is really helpful. It's been kind of frustrating. I just had that a couple days ago because I've been trying to up the intensity, and then the next day I'm just completely tired and shaky. And so it sounds like that's a normal thing.
Absolutely. And I will say, and this is just anecdotally, where we find that people who were pretty avid exercisers before their diagnosis and before treatment tend to want to push themselves to where the level that they were before. And so we often have to say, it's okay to step back during this time. Eventually you may get back there or maybe not, and that's okay. Whatever amount you're doing is obviously better than nothing. And the goal is to progress you slowly, right? We have to, sort of give ourselves a break sometimes, and not expect that we're going to be where we were, pre-treatment.
Thank you. That's helpful. And I don't want to take away from other questions, but it's kind of counter to what sometimes we hear for other people. Oh, push yourself. You have to push again harder. And I find whenever I do that, it just backfires.
Absolutely. Yep. It is not the time to sort of, have that mentality. Like I say,
Yeah.
feel better after the session the next day, and then you're sort of in the right zone, and you can kind of toggle that up and down again, depending on the week, depending on the day.
Thank you.
Yeah, thank you. Let's see, is it okay to exercise with anemia in a limited way? So we do have some guidelines in terms of blood count. So the answer to this is somewhat difficult without knowing the counts, and maybe you don't even know your blood count. So my best advice is to talk to your doctor and make sure that they would recommend it. And again, depending where you are and where you want to exercise, probably not the best time to be in a crowded gym with lots of other people. And often they might refer you to potentially either a physical therapist who specializes in exercise oncology, which would be helpful. So again, I would discuss your blood counts with your physician and see where their recommendation is at. So I guess the short answer is it might be okay, but that would definitely be hard for me to answer. So I'm sorry, Liz, that's not the best answer for you. Yeah, other questions? Swimming in chlorine water. Generally, yes. So there are some contraindications that we typically think about with swimming. So one is radiation, depending if you're receiving radiation. Some people might experience, additional redness or skin irritation from the chlorine, or if you have a port, that's probably not going to be a good idea. But in general, is it safe to swim in chlorine water if you are past all of your active treatments? For sure. Again, being mindful of your blood count. So if you've had chemotherapy, that can negatively impact immune function. And being conscious of public settings, obviously, is going to be probably the more important thing. And hopefully that answers that question. All right, let's see. Who can participate in the FIT cancer program? How far out can you be from treatment? This one I have an easy answer to. The FIT cancer program, again, our goal is to be very generalizable to anybody. So any cancer diagnosis is eligible. Our age limit is simply above age of 18. How far out from treatment? So we have had people as far out as 20 years. And we've also had people who are currently undergoing treatment. So we want to provide a service for everyone who needs it. So hopefully, Diane, does that answer your question? Or is there anything more specific? I'll wait and see if Diane has anything else. All right, there's two more, swimming with a port and vigorous swimming. So again, with a port, I would absolutely check with your physician first. They may say, it's not the best type, if you could pick something else maybe, or they may be able to provide appropriate dressings for you to cover any openings. And again, I think that the biggest thing is making sure it's sort of safe and sanitary and preventing infections, I think would be the biggest concern versus the actual modality of exercise of swimming. So so swimming with a port, I would say that's another one, check with your physician. If they can provide dressings and can give you the clearance to do that, then that might be okay. But if I were to suggest a modality of exercise for someone with a port, I would probably move in a different direction than swimming, if that makes sense. All right, let's see. So we have another question just generally about the Fit Cancer program. So I'm going to come back to that one in case there's more that come up. Light weightlifting after you're done with chemo has a survival advantage. So I don't think we have the evidence available to say specifically light weightlifting. Right now, the majority of evidence is physical activity generally, right? So with most of the studies that look at the endpoint of mortality or survival, we're talking about large epidemiologic studies, right? So we're asking people, a large population, to report their levels of activity. So oftentimes we will convert this reporting to sort of an overall metric of something like energy expenditure or something that reflects just sort of total movement. So what I can say we do have pretty good, again, observational evidence for right now is post-diagnosis, higher post-diagnosis physical activity levels are associated with a lower risk of ovarian cancer specific mortality. So regarding the actual modality of light weights, that I don't think we have the evidence for, but higher activity levels, that evidence is there for sure. I'm just making sure if I missed one. Again, another one with port and seawater. I would absolutely, that's one for sure to talk to your doctor about. You know, preventing infection is going to be really important. Let's see. Laying flat on the stomach during exercise or yoga class always makes someone nervous. Post-surgery, a couple years. You know, again, this one was hard to say without knowing more specifics of your medical history, but if you're still having follow-ups with your surgeon, I absolutely bring that question up to, you know, make you feel better about the safety of laying on your stomach. But if it just generally makes you uncomfortable, I would suggest asking your yoga teacher or exercise leader to provide a modification that could help you achieve the same goal. So let's say it's core stability. Perhaps they can provide you with a modification that would put you in a different position, but still help you target core stability. So hopefully that answers that question. Let's see. I am not familiar with PARP therapy. So I'll let Theodora, if you want to elaborate on that, I can jump back to it. Let's see, how much walking a day is recommended? Ooh, that's a very broad question, believe it or not, for a physical activity researcher. We tend to overthink all of those kinds of things. So in terms of, and I'll try to make it specific for cancer survivorship, again, the modality of walking is, we don't necessarily have the evidence, even from randomized control trials, to say, you know, just walking versus some other modality of aerobic exercise. So I'll kind of generalize that to moderate intensity aerobic exercise. And right now, sort of the minimum exercise prescription to improve several outcomes for cancer survivors, important outcomes. So this might include quality of life, fatigue, anxiety, physical functioning. 3 times a week, minimum of 30 minutes each time is going to be sort of the general goal to get to. So more than that is fine. Again, depending where you are in treatment, where your fitness level is. So the evidence that we have, and again, speaking to just the scientific evidence, is that is sort of our minimum dose where we see a really good response in terms of those outcomes. So hopefully that helps. I know there's lots of studies that have come out in the media with steps, and that's always like, how many steps should you get? Is it 10,000? Now they're saying 7,500. So some of that can be a little bit confusing, but I think in general, we're seeing that a minimum of 7,500 steps a day is sort of a general goal. And again, this is typically in healthy or even older populations to be beneficial for long-term effects. Does that help the walking question. Again, feel free to, jump in either on the mic or on the chat. Let's see, neuropathy. So there are some studies that have shown a benefit of exercise for neuropathy, but in terms of, high grade evidence of efficacy, I don't think we have sort of the highest level of evidence that we do for other outcomes, as I mentioned, quality of life, fatigue, anxiety, depression, and physical function. So I would say the answer is possibly, and again, it's going to depend on the type of exercise, how severe your neuropathy is. There's a lot of other rehabilitative options for neuropathy as well. So I think my suggestion for neuropathy is always to check with a physical therapist and go from there, right? They can prescribe you or help you in other ways in addition to recommending exercise. And again, depending on, the nature of the neuropathy, some exercises are going to be more appropriate than others, right? So for example, one thing that we are conscious of, if someone has neuropathy in their hands or fingers, we would probably not recommend holding heavy weights, right? If we're losing feeling in the fingers, that could potentially result in dropping weights and injury. So we might use resistance bands instead. So again, with neuropathy, I would start with a PT, a physical therapist first, and then go from there. Yeah, barefoot feet walking, potentially, again, some of these things, we may not have the level of scientific evidence for, but, thinking about, what are the sort of dangers of it or risks of it, barefoot walking on the beach, other than maybe some seaweed on your feet, it's probably okay. Let's see. Walking, yep, PT, great. All right, so another question, abdominal surgeries resulting in scar tissue that makes floor abdominal exercise difficult. Do standing abdominal exercises offer a similar benefit for strengthening the core? I think, sure, you can get some benefit. The end result of something like progressive overload or principle of exercise, where we have to keep overloading the system to see continued benefits. You may sort of reach a ceiling effect there, but again, depending what your goals are, maintenance might be your goal, right? So once you've achieved a certain level of core strength and you're feeling great, it's maintenance from there. You're not trying to keep going and get that six pack or anything like that. So I think for sure, standing abdominal exercises can definitely offer benefits for strengthening the core. So I will, unless there's another one, I will jump back up to the question about, is the Fit Cancer program open to international patients? Yes, I believe we had in our last cohort, someone from Canada. So right now, the only limitation, depending international, like overseas, we would probably have a limitation in terms of providing equipment and mailing and customs and that sort of thing. But we were able to enroll someone from Canada. So hopefully that answers that question. Any abdominal exercises that should be avoided after debulking surgery? So, when we talk about exercise post-surgery, we always want to, again, follow your surgical recommendations for time since completing surgery, right? So how many weeks out does your surgeon recommend for you to do exercise, at what level, all of those things. So we always try to tailor, start there and then work forward. But abdominal exercises that should be avoided. We usually try to avoid exercises that are very valsalvic. So holding your breath and really sort of like bearing down. We try to avoid those types of exercises. Also, particularly for comfort, crunching motions I would suggest very light core exercise, again, following your surgeon's recommendations. And if they say, yep, you're cleared to do core or abdominal exercises, start low, progress slow. So, you know, some things you can do, and this is one we do often in our class, and it seems like it wouldn't really do much, but surprisingly for most people, they definitely feel it. So we work on a lot of posture. So sitting up tall and working on simply, you know, engaging your core. And that's something that when I do this all the time, when I'm working, we forget and we're slumped over. So simply just engaging the core. So not necessarily, like I say, like bearing down Valsalva, you should be able to continue breathing while still engaging those muscles kind of around your tummy area. So I think those types of things are going to be a good starting place and much safer than something that encourages a Valsalva maneuver or a crunching motion and twisting motion. I would probably avoid for quite some time after surgery. Let's see. Okay. And I can, and like I say, feel free to jump in the chat and add on to your questions. Feel like I'm keeping up with everything. Next question, how do you enroll in the Fit Cancer program? So I will put our website in the chat here. And so as I'm pulling up our website to put in the chat, our process is pretty simple. You can enroll online. We have a form that you fill out with some health history information that goes directly to our program coordinator. She can review it, and then you can put your information in there so she can call you. You can call our office. You can email us if you just simply want more information. So whichever way is most comfortable and easiest for you is the best way to know. So that's our website there. So if you're interested, you can check it out. So you'll see a link that says registration is open. You click on the link and like I say, it'll ask you a bunch of health questions and your email address, your preferred contact method, and then our program coordinator will get back to you as soon as she can. Any other questions? And hopefully I was able to answer all of the ones above. Like I say, if you want to jump in with your mic on or add on to your question, feel free. It looks like we are slowing down on the chat. We'll also put our lab email on here. And that is another way to get more information about our studies, or if you have questions, we're always happy to answer them. Oh, this is a good one to end on. What is the Fit Cancer program? So I will give a brief overview of the Fit Cancer program. I say brief, but you know, I'm an academic, so that means at least 2 to 5 minutes of explanation. So we started the Fit Cancer program in 2017. And I think I mentioned earlier, you know, we started sort of as a typical group-based exercise program. We ran it out of a local fitness center, as well as at our university at CSU. Our goal in the program is to help cancer survivors become active, return to activity, engage in safe and effective exercises, either during treatment or after treatment. The secondary goal is training undergraduate and graduate students in health and exercise science in exercise oncology. So we do specialized training in behavior change techniques, as well as sort of exercise prescription and exercise contraindications specific to cancer and cancer treatment. So kind of twofold is provide a service to the cancer survivor community, as well as train sort of the next generation of exercise professionals in exercise oncology. So the program itself is 8 weeks long, and we meet once per week as a group to do exercise. And then we also have sort of education and discussion sessions woven into the program as well. So we typically do about 3 or 4 of those education sessions, and we do those right after one of our exercise sessions. So once the pandemic hit in 2020, we paused the program and have now converted it to 100% virtual. So now we do everything via Zoom. So we each person who enrolls will meet with a program staff member to do sort of a pre-program assessment and intake. And then we do our same thing once a week classes, as well as our education and discussion, all in a group on Zoom. And then at the end of the program, you have a one-on-one meeting with program staff again, and sort of do that, sort of checkout process. And we take a few measurements to hopefully see some improvements throughout the program. So I'm happy to answer more specific questions about the program. Let's see. Feel fatigue worse when walking, kayak vigorously for a few hours. Interesting. So someone says they found chemo fatigue worse when walking, but could kayak vigorously for a few hours with no fatigue. I cannot think of an explanation off the top of my head. Potentially, maybe a confounding variable is when you were doing the exercise. Was it always, the same time since completing an infusion? Maybe you were walking like the day after, the kayaking was like 3 days later. So again, it'd be hard for me to speculate, but that's the only sort of explanatory, like I say, confounding variable that I can think of with that. Let's see, someone else provided a resource, an on-demand program called Physical Activity and Exercise for Women with Ovarian Cancer. That's great. Diane, do you have the link for it? And maybe post it into the chat.
That was your program earlier today. Some of the women may have missed it.
Oh, okay, sorry, Mike talk.
Yeah.
It's a good one. Everyone should watch that.
Yeah.
I'm sorry, I thought there was like a different program.
No, they just gave it a really long name.
Got it. Yes, my recording for this, yes, is available on demand. Thank you, Vicki, and thank you, Diane.
It's hard to squeeze everything in. They offer so much every day.
Yeah, definitely. Most conferences are like that. They'll have 2 sessions at the same time, and it's so hard to choose. So it's nice to have the option to watch something like this for sure. And yeah, and like I said, if you have questions about our program or things we do in the lab, I posted our link and our lab email in there as well. So happy to answer questions anytime. And our program staff are absolutely fantastic. They're really, really great at what they do. I cannot speak highly enough of our group. Any other questions? I think we are almost to our time. So any last minute questions, or as I mentioned, feel free to email or pop on our website. Oh, this is a good one. Any research on increasing exercise beyond 30 minutes 3 times a week with increased outcomes? So I'm going to give you a typical academic answer, but I also believe is true, which is it depends on the outcome. So we typically with exercise tend to see the greatest benefit or the most return when somebody goes from, not doing much to doing a little, right? Versus if somebody is already doing 100 minutes of exercise a week and they go to doing 150, we don't see as big of a return, if that makes sense, right? But for some outcomes, we do see a return. So, for example, if we're talking about weight loss, right? That's energy balance, more aerobic exercise, more energy out, you're going to see more return in terms of weight loss, fat reductions. If we're talking about fatigue, I would give you a very different answer, right? Particularly during treatment, I would say, and there's pretty good evidence, to support this as well in the scientific literature, that more is not necessarily better when it comes to fatigue. We might see a bit of a U-shaped curve in terms of, when we start doing some exercise along the bottom, right? Here's our minutes of exercise, and picturing a graph, our minutes of exercise and our fatigue tends to go down. And then as we do more and more and more, the fatigue might come back up, right? So we have to find that balance. Trying to think of another outcome that might be a good example. Physical function, right? So an example might be lower body muscular strength, right? So let's say leg strength or the ability to climb stairs, get up out of a chair. So again, going above that 30 minutes 3 times a week threshold might be adding 2 days a week of strength training, right? For that particular outcome. So let's say you are walking or swimming or doing the elliptical for your 30 minutes 3 times a week. If you add 2 days a week of strength training, particularly for the lower body, absolutely, you'll see larger gains and an improvement in the outcome of lower body muscular strength. So I think, like I say, a lot of it depends on what your goal or your outcome is, and if more exercise is going to be better for that outcome. So, our exercise guidelines for cancer survivors currently are 30 minutes 3 times a week of aerobic plus 2 days of strength training is sort of the general prescription. The goal for healthy adults, including those living with chronic disease, so it's a bit of a healthy but living with chronic disease. So the U.S. Department of Health and Human Services, those guidelines are 150 minutes a week of aerobic exercise plus 2 days of strength training. So what we usually counsel people on is, if you're achieving those guidelines for cancer survivors and seeing good improvements or good return on the outcomes that you're interested in, at that point, is it okay to go up to the 150 minutes a week? For sure. That's where we potentially see more and more return. But beyond that, I think there's less evidence available. So again, sorry, Debbie, hopefully that answered your question in of course, a very complicated way. Let's see, can you increase strength while on chemo, and does the chemo keep those cells from growing too? So I'm always cautious about talking when people are on treatment, talking about increasing and improving, because a lot of the evidence that we have for when you're in that active treatment phase, our goal is often preventing declines, right? So if you were to do nothing, we would often see, so in this case, strength, so muscular strength. If you were to stop exercising when you're on chemo, or even if you weren't exercising before and have chemotherapy, and we would typically see a decline in strength. So if by exercising we can prevent that decline, we consider that a win, right? The time for trying to increase and improve might not be until after the treatment is over, right? So if we're able to prevent decline and sort of keep you where you're at, it's going to be much easier, right? You're at a better starting place to then improve than you would be had you declined in muscular strength while on treatment. So, if we're talking about muscle cells, skeletal muscle, my knowledge is chemotherapy does not prevent those cells from growing or hypertrophying. So, again, we do see some people might improve, right? If they've never strength trained before and start during chemo, we might see an increase. But again, typically, broadly speaking, our goal is preventing declines. Let's see. Another one, exercising in the water really helped after chemo with neuropathy, without realizing numbness in the feet. Yes, absolutely. So again, we talked a little bit about special considerations in terms of having a port, maybe radiation. But if your doctor has cleared you to do water exercise and it's something you enjoy, absolutely. There are a lot of benefits to doing water-based exercise. It's low impact. So if you have potentially other excuse me, concerns, for example, osteoarthritis in knees, ankles, backs, water-based exercise is low impact, so you can get the benefit of aerobic fitness without the impact on the joint. So absolutely, I think it's a great option if it's something that you enjoy and it's available to you. And Debbie, sorry, I'm going to go back up to your question. Okay, so your oncologist was worried that you were doing too much. I gotcha. So yeah, that's interesting. I think if you're feeling good and you're not seeing, as someone else mentioned, right, where they're exercising and then feeling really fatigued afterwards, then it's hard to say stop doing what you're doing. So I would implore your oncologist to explain maybe what her concern is, right? Is she worried that you are going to get too tired? Is she worried that you're going to injure your joints? I would ask more questions. What is the concern about me doing too much exercise or more exercise? So again, I would definitely encourage you to ask a question about that. But if you want, and I can maybe quickly post this link in here as well. The exercise guidelines for cancer survivors. I could post a link to that in there as well, Debbie, if that's helpful, because that's pretty comprehensive. It was just published in 2019, I believe. And that might help you as well. So I can post that before the chat's over. Let's see. Yeah, so Cynthia, she's found that chemo fatigue is generally lessened when she exercises 3 times a week and gets worse when she does less. So like I say, fatigue and exercise is always such an interesting thing and a hard question, because intuitively, right, you're like, I'm tired. Why would I want to expend more energy? That doesn't make any sense. And how would expending more energy make me feel better? So intuitively, it doesn't necessarily make sense. But when we think about some of the pathophysiology of cancer-related fatigue, immune function, and just in general, right, conditioning. And I think this sometimes is the most simple explanation. Often we see sort of this downward spiral with cancer-related fatigue, where you feel tired, so you rest, and then you keep resting, and we start to become deconditioned. And now the same things that wouldn't have made us tired before are now making us feel tired, right? Carrying a laundry basket up the stairs. So it's kind of twofold. There's obviously treatment related things going on, but also a deconditioning. So if we can prevent that deconditioning aspect, we tend to see, less fatigue. And that's evidence in a lot of randomized control trials of exercise. Yep, someone else is really enjoying water-based exercise. Yeah, so someone else, Cynthia also mentioned some YMCAs have exercise classes specific for cancer patients and survivors. So that's the Livestrong program. Not all YMCAs have it, but if you Google Livestrong at the YMCA, on their website, you can put in, I believe, your zip code and find a program near you. If you're interested, I can also actually, there's so many things I need to look up and post for you guys. Another resource is called Moving After Cancer. So the American College of Sports and Medicine has put this together, where you can put in, again, your state, or I think it's just by state, and you can see all of the cancer exercise programs available to you in your state. So basically, they have to be tailored to cancer survivors, as well as have trained professionals who have, like I say, specialized training in exercise oncology. So I can post that as well. Let's see. Someone else said they ran a marathon going through chemo, and it was great. I think, you know, again, that speaks to really the individualization of some of these recommendations. So yes, lots of variability. Let's see. Neuropathy healed in 6 months. Yep. Yep, Memorial Sloan Kettering. Let's see, I'm going to put this moving through cancer. So hopefully, if you are interested in the program, you can find it. And I think most of the ones that they have on here, they've also listed whether they are in person or online. So there is that registry. So you select your country. Oh, they've actually changed this since I last looked. So select your country, your cancer resource, whether you want inpatient, outpatient, patient, digital, online, whether you're looking for a research study. So lots of options for sure. I think I got to this. So if there's any more, I'll just wait, and I'm going to try to find those exercise guidelines. I think that was Cynthia. Any other questions? I can find this one short one. And I think it was Cynthia. If I can't grab the link while we're still on the chat, feel free to email the lab. That lab email, I'll put it in here again. And we can get you some resources about cancer-specific exercise guidelines for sure. Okay, now I found it. So hopefully, I think they're also, I believe this will be recorded as well. So I think you will have access to those, the things that I put in the chat once the Q&A session is over. Caitlin, I'm not sure if I've answered all the questions. Do you want to tell people where to go next? Well, thanks, everyone. I'm not sure if there's more questions, like you say, feel free to jump in. But otherwise, I hope you all enjoy the rest of the conference and you're getting a lot of, I'm sure a lot of information, but hopefully a lot of great information. And I think it's nice that you're able to sort of access it at different times. I know it's a lot to digest. Well, thank you, everyone. I think it looks like all the questions have been answered, but please feel free to reach out if you do have more. And I hope everyone has a great time at the rest of their sessions. So thank you all.